such as the skin, kidneys, spine, meninges, or the urinary system. TB is not spread through contact with personal items, clothing, or through shaking hands. People most susceptible or at greater risk of contracting the disease are people with weakened immune system, patients with HIV, AIDS, or diabetes, smokers, the elderly, patients with organ transplantation, and alcohol and drug users.
Eating, that is what has brought me to the clinic.
Okay. My name is Carrie, and I will be your nurse today. Have you ever had tuberculosis before?
No.
Have you ever heard of it?
I've heard of it.
Have you been tested for it before?
No.
No? Okay, well, from what your symptoms, it sounds like you might have tuberculosis, so we're going to get you a chest x-ray, okay?
Okay.
Hi, Robert. So we got your chest x-rays back. And
there are four I's to consider in preventing TB infections. One I stands for intensified case finding. We'll come back to that, but finding cases of TB. When we talk about that, we'll talk about finding cases of latent TB and what we can do about it, and finding cases of active infection and what we can do about it.
Okay.
The second of the four I's is isoniazid, or INH, an important anti-tuberculous drug that, in the context of this video, we're going to talk about its use in the treatment of latent TB.
Okay.
The third I is isolation, and that we're going to talk about in the context of an actively infected patient, a patient that may be infectious to others.
Lungs, and the extra is which is not the lungs but other than the lungs, like bones, like heart, like spleen, or maybe meningitis or brain, what we call it. So we have a different kind of treatment schedule for them. It's like in simple cases of pulmonary therapy, we have 4 drugs treatment: rifampicin, INH, pyridinamide, ethambutol. Initially, for first 2 months, we give all the 4 drugs, and then last 4 months we give it 2 drugs only, rifampicin and isoniazid.
Prepare for the test by gathering the necessary supplies and equipment. Meet with the client to explain the test, obtain informed consent, and make certain there are no contraindications to giving the test. Answer any questions and ensure the client can return within 48 to 72 hours to have the skin test read.